may have a tough time paying for the bill, so I would give a pretty good nod to those that say this Healthcare Reform Act is perhaps likely to add to the federal budget deficit over time. There's some particular disruptions and challenges that are worth noting. Minnesota has a pretty robust set of state laws and regulations already in place. The federal law is in conflict with some of what's already been put in place in Minnesota. Some of the restrictions around rating means that people who are 55-ish may end up paying less because there are going to be some limits on age rating. So some people may think that's a good thing, some think that's a bad thing. People who are maybe 30 are probably going to end up paying more because there are limits on age rating ranges. So a lot ends up being, how do you feel about that? And the question is, do you think the people who are 55 should pay a lot more? Do you think the families that are 30, maybe not quite into their prime earning years, or maybe they can't afford to pay so much? So there's going to be a lot of discussion, I think, about the impact of some of the particular decisions and how it reflects our values as a community and as a country. Another piece of this that I think is particularly interesting, we really didn't have any discussion about what's the role of the consumer. You know, what should we be paying for health care? Not in our monthly premiums, but when you go to the doctor, is there any reason that you have a $1,000 deductible and you pay $10? If you have a medication, how much should you be paying for that? What are the incentives that we want to have for individuals and families when we look at health care? Not really on the table, and some pretty mixed messages in the healthcare reform discussion that took place as well. So I think that's uncharted territory yet in how America wants to structure its healthcare services going forward. So to quickly summarize, more people will have coverage. I mentioned the 20 to 25 million Americans who will get coverage through who will access coverage because there's a requirement. Many will need a subsidy through the exchange. There will probably be another 15 million that will have access to coverage through the Medicaid program. So Medicaid will be expanded quite significantly, and through the combination of those two, we'll get somewhere between 35 and 40 million Americans who will have coverage and haven't in the past, or that's the aim. And then this challenge of how do we really change the costs of health care? Doctor and hospital fees, use of doctor and hospital services and medical technology, consumer behavior. We've got a lot of work to do on that. And then the question of funding that looks to me to be a pretty challenging aspect of the reform going forward. So I guess these are some of the things that we at least think represent real healthcare reform that haven't fully been fleshed out in the work that's been done so far. And I put support healthy life choices at the top of that list. America is really on a runaway railroad in terms of a collision of an aging population and unhealthy lifestyles coming together. The fastest growing disease in the country is diabetes, adult onset diabetes. The number one cost to the Medicare program today is diabetes and its associated comorbidities of heart disease and vascular disease. And yet, that will run smack into the challenge of making healthcare more affordable. And so I want to talk a minute about that. I think this AAA really putting together better health, more affordable care, and outstanding experience has got to be part of the work of healthcare reform. There's a real need to look at how we pay for our doctor and hospital services. We've got a production-based payment system with physicians and hospitals, and I'm not sure we're getting the value out of that. Most of us, when we deal with outside counsel, we try to negotiate fixed rates or package rates for services, and yet our healthcare system is entirely on a fee-for-service basis yet. Health information technology, I think, has an incredible opportunity value and cost of healthcare services. Most organizations are still pretty new at using electronic medical records and health information exchange. And as new users, you're really looking at, can it be a clinical information system? Can we store information that way? Can we get it when we need it? The opportunity is really what we do with it from here to make it a much stronger, more effective tool at improving health. We know we need to do more to engage consumers in quality and cost, better choices about healthcare services, a ton of room for innovation in healthcare, which has been kind of locked in the dark ages in terms of some of the practices that we've had in the past. And nobody wants an extra dime of their money to go to administration. And here's another area where healthcare is really full of opportunities to tackle the administrative cost burden that's part of the healthcare challenge. So I want to make I hope, the strongest case for the lifestyles. You know, there are 4 behaviors that impact 25% of healthcare costs. I've listed them for you. Interestingly enough, people that live these 4 different behaviors also live, on average, 14 years longer. And they're not like sick, terrible years. They're actually good quality of life years that you're able to add when you're living healthy. So a healthy diet of 5 fruits and vegetables, regular exercise, 30 minutes at least 5 days a week, responsible alcohol use, which is 1 drink or fewer per day for a woman, 2 or fewer a day for a guy, and then not smoking. No, not the highest bar, it seems, yet we looked at what percentage of the people that take our health assessment are actually nailing all 4 of these. You know what that percentage was? Do you have a guess? 10? Close? 20? It was actually 8. And they're just regular people like all of us here. And you know, the weak spot actually, you can probably guess it, 5 fruits and vegetables. That's even harder for people to pull off than 30 minutes a day, 5 days a week. But the opportunities there to have a real impact on quality of life, length of life, and healthcare costs by these changes. In fact, one of the more interesting things we're doing is, you may have seen earlier this year, there's a series of articles talking about antidepressants. So, you know, one of the top prescriptions for any organization, any company is antidepressants. And yet, whether antidepressants work effectively in cases of mild or moderate depression, really up for grabs, and whether the medications are actually used effectively, another big question. Billions of dollars. There is compelling information that says if you're walking every day, you will have an incredible impact on your symptoms of depression. So our aim isn't to say don't use the antidepressants. That's would be really counterproductive. But it's to say when we give you a prescription for an antidepressant, let's give you the 10,000 steps walking program at the same time for free, so that maybe we can put together some healthy behaviors that are shown to be as effective as some of the medicines that we use, to at least hope in combination doing a better job dealing with symptoms of depression for people who have that particular illness. And I think that's just the start of it, you know, that healthcare is really on the brink of busting out of the exam room. So whether it's what you're doing online at home when you go to WebMD, what you do when you call the nurse line for better information, what happens when you go to work and there's an increasing number of companies that have online, on-site work locations, the very blurry line between what happens at your health club and what happens at your doctor's office. We are really taking healthcare from being a location-specific activity to being an everywhere activity. And you know what? It will be more effective to talk about nutrition with you outside of the gown on the exam table with the doctor in the room. It will be more effective to talk about how you're doing on your exercise plan over